Do you have knee arthritis, Brad? And are you thinking you're going to need surgery?
Boy, I've had that question asked to me many times by
Maybe,
patients.
maybe not.
Right.
Stick around.
Bob and Brad, the two most famous physical therapists on the internet.
All right, before you consider having surgery on your knee, you should definitely try these 4 or 5 things. I want you to give a good effort towards it. So
Exactly. There are things you can do at home.
that's basically what we're going to call a shotgun approach.
That
Maybe
sounds pretty serious, Bob.
maybe we should change the word. But we're going to talk about first activity modification. So for a trial period, I wanted to get the knee to calm down. Knee arthritis tends to flare up and it calms down. So for a little while, I'm going to recommend you use a cane.
So this would be my flared up knee. I'll just pull that up. So if it's flared up and you keep walking on it or hurt it, then it just continues to flare and irritate it.
Right.
We want to give it a break, take the weight off it by using a cane. This is a family heirloom anyways. You probably will have a modern cane that you can adjust to get to the right height. But you're going to use a cane in the left hand if it's the right knee, and we're going to walk like that. And I've never had anybody with knee pain or hip pain, and I gave them a cane, and I say, "Can you walk with them?" And they'll say, "Well, yeah, that helps." Sometimes not enough to warrant
Right.
them giving up their
It
dignity
always
for
helps.
the cane. Yeah,
It always helps. I would highly recommend this one. For me, Brad, quite often it's just this one thing that makes difference.
yeah. It's
So,
just quit irritating it, let it settle
so
down.
avoid stairs, avoid hills as much as you can.
Yeah,
Use the cane just at home if you are really self-conscious about it.
yeah, that
So,
can be an issue.
number two, we're definitely going to need some physical therapists.
You gotta drop to that level. We gotta go see the therapist.
No, you want to. Are you going to try some things that we're going to recommend? So the first one is, Brad, you want to strengthen the quadricep, which is the muscle on the front of the knee.
Yep.
That is the muscle that tends to get weakened after you had arthritis.
Right. When
for
you
a
have
while.
pain, the body just kind of tells
Right.
that to turn off.
Very
and,
simple.
Yep.
Yeah, you take a pillow, fold it in half, put your knee on top of it, and you're going to push down and straighten the leg out, and like you're trying to push the knee down into the bed.
Squish the pillow
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
so he can count to 10.
3 sets of 10. I'm
So-
just showing off.
You know, you can do this one in a couch. That's pretty nice because if you can lean back a little bit to
Sure.
the armrest, it's a little more comfortable and watch TV a little.
Very good. All right, Brad. How about extension?
Yeah. So extension, getting the knee straight, oftentimes can help more with walking than flexing it. You want to check your knee that it does go fully straight. You can compare it to the other one. Let's say this one goes straight like that, or let's do it this way. This one goes straight, and this one only goes that far, and they're not even. So I'm going to.
Very often it's very subtle.
Yeah.
Yeah.
Yep. So you can do it on the edge of a chair like this and push down above the kneecap gently and push, maybe 5 to 10 repetitions. If you have a stool, an ottoman at home, that can be used.
Yeah, Brad, want to also show that you may want to turn the leg out or
Yeah.
turn the leg in.
Yeah, and that's where it works in handy when you do have it up on here. Are we looking from the other side, Tanner? This is kind of fun. Yeah, rotate to the outside and then try to push down. See how that feels versus neutral or straight up and then in. Now, I found with my patients, oftentimes it was going to the outside. That would allow it to get better range of motion and feel better. But that's, that's why we try everything.
We are also going to stretch it the other way into bending. So if you scoot your butt forward in a chair,
This is one time
Yep.
we allow slouching.
that's right. And then you just go ahead and reach back, down, and pull back.
Yep.
The same thing, pressure on, pressure off. Maybe 10 repetitions.
Yep. It may vary if you put your hands up closer to your knee or farther down by your ankle. See what works best. It works best if it feels better and gets range of motion
The other
better.
thing throughout the day, I like to see that you have some repeated movement without weight bearing. So all you have to do is do some of these.
Right. 5 to 10 of them, particularly before you stand up if you've been sitting for a while.
If you want, you can make it very simple using the knee glide.
Oh,
right?
yes,
You
let's
have
just
that?
use that. This little device that,
And you can use that for a half hour at a time.
yeah. And now Joni, our office manager, has
Is
got
doing
knee
this,
problems.
right.
Yeah, she's 64 now, waiting for the magic age to hit that paid,
Sure.
Boy, and she says this is working very well for her.
Awesome.
Yeah. So it works well to get on an angle. That'll help the quads a little bit more versus this. What's next, Bob?
Another treatment you could do is in bed is actually sit up like this and put a roll towel underneath your heel and trying to straighten your leg that way. And,
This bump right here makes a big difference.
right. And you can do it, put a cold pack on there while you're doing this.
Yep.
Now, if you want to get fancy, you could even put this on the knee glide,
There we go.
and now it's going to straighten a little bit while it's all trying to straighten.
And then you can go up and down with that a
Yep.
little bit. Sometimes
Oh,
these little
right.
motions can be helpful.
Exactly.
Tip the toe out to the side, try it.
Right.
Tip the toe straight ahead. Too bad your body's in the back or way of our camera. Can
Oh,
you
that's
see
right.
anything from that way? That's all right.
This actually works out really well.
Yeah, it just is it's a beautiful thing.
All right. Number 3, ask the doctor about using an anti-inflammatory. You might just simply take ibuprofen,
Right.
or they have prescribed like naproxen, stuff that's a
Right,
little bit stronger. Number 4, ask your doctor or pharmacist about injections. Is it time to try a corticosteroid
Yep.
injection, or they also have injections that are lubricants?
Right.
So
The
you're going to have to ask them.
Right. We do have a really nice video if you Google Bob and Brad.
Where we have Chris the pharmacist.
Yep, and he explains it in detail. It's a very good video.
I would, without a doubt, try these 4 things. I said 4 or 5. It's 4.
Who's counting?
Before you have surgery. I mean, it's going to help you when you do have surgery,
Right.
if you do.
Yep.
And it may delay it for years,
Right.
if
Absolutely.
not forever. So remember, Brad and I can fix just about anything.
Except for
A broken knee, a broken heart, a broken heart.
broken knees are hard to fix.
Yeah,
That's usually
that's right.
surgery.
Yeah.
Well, or a cast. But anyways,
But we're working on it.
now
right,
we're
Brad?
babbling. We're trying to
Yeah,
cut down our babble.
That's
but,
right. We're working on
They've tuned out
working
already.
hard. Yeah.